Mosquitoes are mischievous, they like to drink our blood. Buzzy little critters, ooh, ooh. The female is the only one who likes to drink your blood. Bitey, itchy insects, ooh, ooh. The male eats only plants. They live near water too.
What are we going to learn today? A little bit on intro of dengue. Next is the immune system. Sebenarnya kalau nak faham dengue, you kena faham how our immune system work first. That's 2. 3, the pathophysiology of dengue. Okay? And 4, how you manage. So very simple. Okay, we just learned a bit of intro, immune system, pathophysiology and management. This is going to be the outlook of our class today. Okay? Now, first thing we go into intro. Okay. How bad is dengue infection in this country? Okay. Although the deaths, okay, the number of deaths are significantly rising, okay. If comparatively the percentage it is dropping, okay, but the number of deaths, the number of cases are on the rise, and the number of deaths are also significant, okay. So the thing is, why are people dying out of dengue? There are 2 causes. One is either under volume or over volume, and sometimes even up to severe dengue cases because of complications, multi-organ failure and so forth. Alright? So because of this, in order to understand the enemy, which is dengue here, we need to learn our enemy in and out. The problem is, if you do not know the enemy will outclass you at every move. Biasa tengok tak Superman dengan Lex Luthor? Tahu tak siapa Superman? Do you know who Superman and do you know who's Lex Luthor? Okay, Superman has powers. Lex Luthor got powers or not? No powers. But Lex Luthor is how many times he managed to kick Superman's ass? Correct or not? With no powers. Why? Because he's evil, but he is very smart. He can outmaneuver Superman in every way. Same, Batman and Joker. Joker also will outmaneuver Batman in so many moves because they think 2-3 steps ahead. Correct? That is the characteristic of an evil character. Dengue is evil. Dengue will always outthink us 2 to 3 steps ahead. So in order to beat the enemy, we have to understand the enemy deep down. Truly understand how it works. Only then, before it can act, you can corner it and stop the effect. Understand? So, you can't just simply treat dengue when dengue comes. You need to know exactly how dengue works, how dengue operates, how the virus works, before you can finally say that I am confident in treating dengue. Okay? So number 1, let's go into our dengue infection. Okay. So first and foremost, dengue. How many kinds of viruses? Okay, first, who carries the virus? Aedes mosquitoes, right? So there are 2 types of Aedes mosquitoes, okay? So they are mosquito borne. So number 1 is Aedes albopictus and Aedes aegypti, okay? So we need to know the breeding patterns and all that, okay? So that is why the fogging is usually done more of late at night, okay? In dawn and dusk, this is where the mosquito will tend to breed, okay? Alright, now, how many types of viruses there are in dengue? 4 types of viruses. And what are the names? Then 1 to 4, okay? Then 1, then 2, then 3, and then 4, alright? So you have that 4 dengue viruses. Okay, next, how does our body respond to an infection? We need to learn that first. Okay, our body's immune system is broken into 2. One is innate, which is the first line, and second is adaptive, which is the second line. Okay, what makes us different than the sotong, okay, a squid or Squidward, is that we have adaptive immune system, whereas invertebrates have just innate immune system. Okay? So, whenever an infection enters our body, may it be virus or bacterial, it always boils down to who is going to respond. Is it the innate system and the adaptive system? But innate system is the orang-orang bawahan, okay? All the macai, the kuli batak. Whereas the adaptive is the senior police inspectors. Okay? Alright. So now, who makes up our innate immune system? Who? Skin barrier. Kita ada barrier kan, skin. That is why when you have any laceration, organisms enter. Alright? So the first thing our innate immune system is your skin. Physical barriers, any physical barriers. Okay? Then what's next? You have neutrophils. These are all the myeloid cells. Okay? From the marrow, you have the myeloid cells and the lymphoid cells, the stem cells. The myeloid cells will give out this innate immune system. The lymphoid cells will give out the adaptive immune system. Okay? So myeloid, you have skin, neutrophil, lagi? Macrophage, lagi? Come on. Natural killer cells, lagi? Eosinophils, lagi? Basophils. Come on guys, come on. Okay? You have to know this because you want to understand how the DAN virus works. Okay? So first, you have skin, neutrophils, macrophage, natural killer cells, eosinophils, basophils. All these are myeloid except for natural killer. Natural killer is from lymphoid. Okay, now, when an infection enters, say bacteria or virus, okay? Just say any bacteria or virus, okay? Usually, innate and adaptive will respond. But, in innate is usually they are more adapted for bacterial infections. Okay? So that is why when bacteria enters, who will respond first? Neutrophils. Neutrophils are also known as phagocytes. They eat the bacteria and inject hydrogen peroxide and destroy it. Okay, this is the process of phagocytosis. So that is usually for bacterial infection. That is why when you deal with the bacterial infection, what count goes up? White count goes up, betul tak? Predominantly neutrophils. Why? Because that tells you that it is a bacterial infection, because neutrophils are the best to deal with bacteria. Bacteria ni dia besar, dia bodoh sikit, dia gerak-gerak, dia tunjuk himself here and there. So the neutrophil nampak ngap makan dia. Okay? Macrophage also same. Macrophage were monocytes from the bone marrow, but in the blood, from monocytes they change into macrophage. And sama, macrophage pun will eat up, okay, phage and cause phagocytosis. But what differentiates macrophage from neutrophils? Macrophage, okay, is the mata gelap. What is mata gelap? Spy. Why is macrophage is the spy? Because if you look at the adaptive, who is the cells under the adaptive system? The chief inspectors. Tuan, bini. Okay? T tuan, B bini. Okay? So, ni laki bini dah lah, biar bini dengan suami dengan bini. Okay? So, tuan and bini. T cells and B cells. These are the smart people of our immune system. Okay? I'll go into them in a short while. But you see, T cells and B cells are the ones that will remember what antigen comes in, respond again in the future, and effectively kill off any infections that come or any reinfections. These two people have memory of infection that comes into your body. Versus innate, they don't have memory. Okay? But there must be somebody here who is a mata gelap or a spy that is going to confer information to the adaptive cells. Tell them, got this infection coming lah. I give you information, you faster proliferate, create more memory cells, create more cells, and later you remember who. So, who is the flow who communicates with this guy? Macrophage. That is why macrophage is known as a antigen presenting cell. Dia makan antigen tu, bukan setakat dia destroy, dia tunjuk antigen tu dekat T cell and B cell, T cell and B cell will further respond. But most of the time, bacterial infection does not need to go this stage because neutrophils are enough to respond. Okay, your bacteria are gram-positive. That's why bacterial infections kita tak berapa worried. Kalau patient datang bacterial infection, white count is high, we give antibiotics, state blood, CNS apa semua tu, make sure that the patient has antibiotics, and if the patient improves, immune system is good, patient is able to clear the infection. Okay? Faham tak? So usually bacteria not really an issue. Now virus. Let's look into virus. How virus how virus interacts with our immune system. When the virus enters, okay, is the neutrophil and macrophage enough to deal with the virus? Tak cukup. Because viruses are very smart. They hide amongst us. They go to a cell, they inject their DNA or RNA, depending on the type of virus, into the cell. Then they will inject their DNA or RNA into our nucleus, into our DNA, and force our cell to produce more of them. And then they leave the cell, and the numbers multiply, 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 and multiply. That's how viruses work. So viruses are very good at hiding within our cells. Sometimes they can enter a cell and inactivate the cell's defenses, so the cell cannot shout for help to the immune system. That's how dahsyat virus is. Okay? So before even you go into dengue, you need to understand how virus works. So that's how virus. So virus enters our body, virus replicates, and virus starts doing all sorts of nonsense. Okay? If you're talking about, okay, there's so many viruses. Okay? If you're talking about MERS-CoV, chikungunya, whatsoever, but these viruses will cause this influenza-like illness. Okay? That is why when patients come initially with viral-like illness, they will come with, what they'll come with usually? Fever, myalgia, arthralgia, flu-like symptoms. Okay? Why all this is happening? Because the body is trying to respond against the virus. Okay? So now the virus has come in. How are we going to respond to this viral infection? First line akan pergi nak makan. Tak jadi. But macrophage is there. He is the spy. Dia akan makan virus tu. So once it eats the virus, then it has got this antigen inside. But can the macrophage do anything to it? Probably nothing much. Can't deal with it. Phagocytosis is not going to kill a virus because the virus is very, very smart. Okay? So what the macrophage does, it goes to the T cells and B cells. T cells and B cells are abundant where? In what part of your system? Which part of your body? Where? In your lymphatic system. In your lymphatic system, okay? Especially B cells. T cells are there, also in the circulation. They are also there in the circulation, but they are abundant in the lymphatic system, especially in the lymph nodes, where it is the major part where this adaptive system works. These T cells and B cells. Okay, now, let's see how these T cells and B cells will respond to a viral infection. So first, macrophage will eat the antigen and present the antigen to T cells and B cells. Okay, first we go into B cells. How do B cells work? What do B cells produce? Antibodies. Antibodies. You need to learn this because later in dengue, can't we send a lot of investigation, right? All your IgG lah, IgM lah. We need to know this in detail. Okay? So now, it presents the antigen. This is all viruses are not just dengue. All viruses, it works the same way. Macrophage takes the virus, presents it to the adaptive immune system. Okay? T cells and antigen presenting cells. So, I'm the virus. I've just entered the circulation. I am blending it with everybody. Okay? It's like, I see all the other cells say, hey, what's up? Where are you from? Oh, no, I'm from here. I'm from here. I'm not from outside. I'm from here. Kawe magi Kelantan ya, orang Kelantan. So outsider come to Kelantan, try to create problem. Okay, say he is Kelantan, nobody can recognize him. Dia gecek Kelantan pandai. Okay, alright. So now he's hiding there. Okay, nobody seems to be able to attack him. But macrophage already took him and then go into the lymphatic system and present to the B cell. B cell, bini, ingat boleh lari dari bini. Ingat kalau malam-malam bini tak tahu. Bini mesti boleh tangkap, betul tak? Betul. Ke tak kahwin lagi? Tu dah ada experience dah tu. Malam-malam tak boleh lari keluar. Bini tahu punya. Okay? So you cannot lie, you cannot cheat the bini. Bini is too smart. So B cells will see the antigen. What does the B cells do? B cells will start producing antibodies. Why? You see, within the lymph node, okay, I won't go in detail but within the lymph node, when the antigen comes in, okay, this antigen will cause the B cells to mature. Okay, the B cells will mature, and specific B cells will start producing this, what we call as plasma cells. Okay, plasma cells, which have mutated to adapt to this antigen. Okay, the antibodies are very specific to certain antigen. Faham tak? If you have, for example, dengue virus, or for example you have a different virus, contoh apa contoh lain? Bukanlah. Okay, alright. So any other viral infections, okay, like for example rubella is a virus, right? Yeah, chikungunya ke whatsoever. Okay, Okay, for example, H1N1, for example. Okay, so whatever viruses that enter, our body's B cells will take this antigen, will morph, or dia akan tukar dia punya configuration, produce these plasma cells, and these plasma cells will start producing antibodies. So how do these antibodies interact with the antigen? Ni antigen tengah duk jalan kan, semua orang tak kenal dia. So how are they going to destroy him? Antibody, plasma cells will produce antibody. Antibody akan bagi topi dekat dia, topi macam ni. Kan? Pernah tengok antibody? Antibody ni kalau you terbalikkan nampak macam topi sebenarnya. Kan? Betul? Topi. Betul? Dia akan letak topi atas antigen tu. The antigen is going around, why am I suddenly having a head? Basically, that head is a signal. Pernah main Counter Strike? Nampak tak yang signal reticle headshot tu? Sebelum dia nampak tu, dah ada signal dah, tanda merah untuk headshot. Betul? You see, because each antigen is different, different caps have to be made. Cap yang untuk masuk kepala dia, mungkin kepala dia terlampau botak ke, kepala dia ada rambut ke, ataupun telinga dia terlampau besar ke. Okay? So that is why, kalau antigen tu, dia punya kepala terlampau besar, specific plasma cells is to produce antibody that can fit into the antigen. That is why antibodies are very antigen specific. Okay. And what happens when suddenly this antigen have a cap? Tak boleh tipu dah lah. Orang sini je, dah ada topi dah. So what does that topi do? That topi marks the antigen for death. Meaning that now, semua immune system dalam badan kita akan alert. We have an intruder, everyone have to attack. So siapa akan attack? Innate and adaptive akan attack. Neutrophils ke, macrophage ke, T cells ke, B cells, but most of the time, kalau virus, T cells will attack. T cells dah pandai dah. Oh, kau cuba nak sembunyi. Sekarang kau ada topi, mampuslah kau. Lepas tu start lah Japanese fighter. Okay, alright. Okay, so now we already learned about B cells. Faham tak B cells ni? So B cells are very important because from the moment the viral infection comes in, it goes into the lymph node, the B cells will morph, tukar dia punya configuration, produce specific plasma cells to produce immunoglobulin. And this immunoglobulin will attach to the head of the antigen, mark the antigen for destruction. And who will come to destroy? Your innate system and also your T cells will come and destroy. How exactly they destroy? Banyak cara untuk destruction ni. One is complement activation. Proteins will cascade, buka lubang dekat antigen, masuk drugs, pecah antigen tu. That's complement activation. That is from the liver. How else? T cells also will produce two types of T cells. T cytotoxic and T helper cells. T cytotoxic pun sama. It will recognize antigens that have been marked with the cap, go there, attach, insert chemicals and destroy the antigen. Okay? Faham tak? So, not only that, they also produce cytokines. B cells and T cells also produce cytokines. This one also another chemical that you must understand. What are cytokines? Cytokines are all your interleukins. They are the anti-inflammatory dengan pro-inflammatory. What are cytokines for? Cytokines are also inflammatory markers. The moment cytokines is secreted, dia akan attract all the lymphocytes and all the innate immune system to come over there. Basically, cytokines are inflammatory markers. Okay? Nampak je antigen, all crowd there, release cytokines, semua akan datang. And cytokines will also help the area for inflammation. Faham tak? Okay. So this is what happens. And after all the antigens are destroyed, what happens? The T cell will develop T memory cell. B cell will develop B memory cell. So whatever antigen that came in just now, contoh, if it's chikungunya virus, the T cells and the B cells took some time to react because it was the first time they're dealing with the virus. But the moment they destroyed the virus, they develop memory cells. Why? Next time the infection comes in, they can immediately recognize this antigen and they can very super fast produce specific T cells, specific B cells. Okay, T cells will attach and destroy, produce cytokines, call more people to come and help. B cell will produce antibodies, attach to the antigen and mark for death. This process happens faster. So that is why you develop these immunoglobulins and they will persist for years and sometimes for lifetime. Faham tak? Before we go even further, you need to know about immunoglobulins. How many immunoglobulins we have? Gamed, kan? So before we go further, IgG is immunoglobulins that is abundant in where? IgG and IgM are abundant in the blood. Okay? IgG and IgM are abundant in the blood. Okay? What's the difference between IgM and IgG? IgM is short term. When the infection comes in, the body needs to produce antibodies, right? Okay? These antibodies in the blood is known as IgM. IgM will mark the antigen for death, but it lasts only for a short while, usually around up to 3 months. Then your body starts producing another type of immunoglobulin which will last longer, so that when the infection comes in, it can react immediately. So that is known as IgG. IgG can last for years and sometimes even lifelong. Okay? A is where? Mucosa, betul. Okay? E for allergic reaction dekat mast cells, basophil. Okay? IgE is for allergic reaction. D? Tak tahu. Okay, tak apa. Balik baca. Okay? But the main is if you want to understand dengue, remember that what is IgG and IgM? They are immunoglobulins. What are immunoglobulins for? Topi for the antigen, head for the antigen. And what is the head for? Mark for destruction, so that the antigens can be rapidly destroyed by the immune system. What immune system? T cells, B cells, and also all your innate immune system. So, now let's correlate clinically. Bila patient datang dengan viral infection, apa dia punya first symptom? Dia akan cakap, selalunya dia akan datang dengan, the patient will come with what? Fever, lethargy, muscle pain. Okay, why all this happens? Because when there is an inflammatory reaction, cytokines is produced, correct? In that cytokines, there are tumor necrosis factor. There is also prostaglandin. They will go to the thermostat, okay? They will go to the hypothalamus. In our hypothalamus, there is a thermostat. And they will cause the thermostat to increase the temperature. Why increase temperature? Why increase your body temperature? Because sometimes just increasing the base temperature is enough to deactivate the virus. Okay? Deactivate some of the virus. But not only that, our immune system works better at the higher temperature. So that is why our body increases the temperature. So what happens bila body tries to increase the basal metabolic rate, increase temperature? You start menggigil, shiver. Why you need to shiver? Increase muscle contraction, increase more heat produce. Because more muscle contraction, more aerobic glycolysis, more heat is produced. So patient will come with seram sejuk seram or whatsoever. Okay? Chills and rigors, okay? And they come with fever. And because of that chills and rigors, they'll also feel all this lethargy, myalgia, joint pains, and all that. Okay? What other symptoms they have? Come again? Running nose. Because they also, most of these viruses also will trigger influenza-like illness. Okay? So they will have cough and cold. All these symptoms are classic of virus. Our body has just started responding to the infection. So that means now our T cells and B cells, because first time the body is responding, so it takes some time. Okay, how long usually these symptoms last if it's virus? I'm talking in general for all virus. How long usually these symptoms last? Around 3 to 4 days. Then what happens? After that, patient is cured. Betul tak? Why cured? Who cured the patient? Your adaptive immune system. They created the immunoglobulin. And also they started producing T cells, T cytotoxic and T helper. T helper is to help mature the B cells to plasma cells. Alright? So our T cells and B cells got together, destroyed the virus, and this time they have T memory cells and B memory cells. Next time, that same virus attacks the patient, they will not have this influenza-like illness anymore. Why? Before even they can develop symptoms, the immune system would have destroyed them. Okay, so this is in general. So any viral patients that come to you, patient is fine. Patient has got some symptoms, fever, cough, running nose, apa semua tu. But if patient is well, patient doesn't have any what is called later we'll call any red flag symptoms, then you can safely say this is a viral infection. Let it run its course. You don't even need to give antibiotics. Why? Because it is not bacterial. This is for viral. Viral is just, you just let the body do its course. And eventually patient will be well, patient can be discharged. Alright. So understand about viral. This is very, very important. Now, let's see how the Dengue virus has evolved and cheat our immune system and make us die because of dengue virus. Boleh tak? So before you all proceed, faham tak pasal bacterial infection, viral infection, our immune system, how our immune system responds, how the innate system works, how the adaptive system works, how T cell work, how B cell work, how they form memory cells and how they deal with viral infections. Usually in viral infections, apa yang akan naik? Your lymphocytes. But you notice or not? Most viruses, when patients have viral infections, the white count will drop. And the platelets can drop. Even Ebola virus, some of the viruses have the same features. White cell will drop, platelet will drop. Why? Usually in bacteria, white cell will go up. But for viral, some viral, especially Ebola, dengue and whatsoever, white count will drop, platelet will drop. Why? Virus is very smart. The virus knows that who is the one that can destroy him. Virus, siapa yang boleh destroy virus? Sini ke sini? T cell and B cell. T cell, B cell produce from where? Bone marrow. Betul? Bone marrow kan? Okay, from your lymphoid cells. So, the virus wants to survive. So what the virus does? The virus goes to the bone marrow and bukan destroy lah, inactivate. Okay, they inactivate the bone marrow. So the bone marrow is unable to produce white cell. Sebab tu viral infections, they can survive a little bit longer because some of them, especially like Ebola and dengue viruses, have evolved to the extent they can inactivate the bone marrow. So because they inactivate the bone marrow, your white count will drop. And in the bone marrow also got platelets, so platelets also will drop. But clotting factors don't drop. Why? It does not affect your clotting factors. Clotting factors is produced where? In your liver. So clotting factors will still be there. Patient will be able to clot. But why patients still bleed? In order to form clots, you need to form the primary platelet plug first. Then only you can coagulate. So if your primary platelet plug cannot be formed, how is the coagulation going to work? So patient will still bleed. That is why not only dengue, mind you, some other viruses as well, like Ebola, does the same thing. They inactivate the bone marrow, drop the white count cannot be produced, platelets cannot be produced, patient will bleed. And if patient got any superimposed infection, such as bacteria, can the patient survive? Cannot survive, because there's not enough neutrophils being produced. You see not how dahsyat these viruses are. That's why you don't play viruses. Viruses mutate very fast. And viruses, the way it interferes with our body is just superb. To see how they've evolved to suppress our immune system. Okay? Now, you understand this or not? If you understand this, then we can move to the next step, which is how Dengue virus comes into our body and causes so much problem until we have come up with multiple CPGs and so many mortalities. Okay? So let's see how Dengue virus interferes with our bodies. Very interesting. Okay? Any questions up to now? Faham tak? Ke I'm too fast? Faham Boleh Okay. So if you're still a bit blur, please go back and learn about all your immune system. Just read a bit about how T cells work, how B cells work, okay? That is why in like certain immune, right? Like for example, chicken pox, kan? Varicella zoster. We give patients inactivated virus. And then the body starts producing plasma cells and antibodies against the inactivated virus. So later patient will develop immunity towards the virus. Betul? So you start producing immunoglobulins that give you protection lifetime. You get chickenpox only once in your childhood, then you never get it again. Why? Because the body produces immunoglobulins that will remember the infection for lifetime in the form of IgG and IgM if it's in the blood. Mucosa means IgA, alright? If it's your allergic system, your allergic system is IgE. Okay? Okay, now what I spoke about this now was in general viruses. In general, how viruses happen. So you will see a lot of these patients in your green zone. Patient datang, fever ni, bagi PCM, advice minum air banyak-banyak. Patient pun marah sebab tak start antibiotik. You bagi tahu lah berapa banyak kali pun dia cakap, you don't give me antibiotic, you bad doctor. Then you discharge the patient, then patient will go and take ubat kampung, but because already third or fourth day, then patient will say the ubat kampung work, you didn't help him at all. Isn't it? Okay? Alright, but that's said and done. That is how in general viruses work. But what makes dengue so special? You have 4 dens, okay? Then 1, 2, 3 and 4, okay? Alright. Your first dengue infection, just say around here, the mosquitoes are carrying den 1. If you get infected at den 1, is it deadly? When you get infected with the first dengue subtype, which is any of the dens, for the first time, usually it's just like any other viral illnesses. It's called primary dengue infection. Patient will come with classic, your fever, cough, cold, okay? Your myalgia, arthralgia. Then after that, patient discharged. At this stage, usually, patient do not develop any warning signs. Nothing. Patient 0. Patients will just be treated like any other dengue infection. Alright? Faham tak? So primary dengue infection usually is not deadly. It's just like any other viral illnesses. Okay? Usually it's difficult to say that this is dengue because they present just the same as other viral infections. So what the body has done, the body has recognized the one den. Kita ambil contoh lah, den 1. So the body has recognized den 1. It has start producing immunoglobulins against den 1. So next time when den 1 comes, your body will eliminate perfectly because it has already developed what kind of immunoglobulin? Ig, G and IgM. IgM is short term, IgG is long term. So next time when den 1 comes in, your body will be able to destroy it. So no issue. Why in dengue it becomes an issue when the first infection does not really do much harm, but the second infection does havoc when it comes from a different subtype. Why? Let me tell you why. Okay? Okay, so now den 1 is already out from say Kelantan. Okay? No longer den 1. Then some other fella brings in another den from another state. And now the mosquitoes are spreading a different den. Say den 2. Okay. Same thing. You have your innate and your adaptive. Okay? So same process. Den 2 comes in. Okay, macrophage, our mata gelap will pick it up. Okay, macrophage will pick it up and present it to your T cells and B cells. Okay, present it to your T cells, okay, and B cells. So macrophage will present, the antigen will be there. Okay, so this is den 2, right? Okay, so the T cells will attach to den 2 and try to destroy den 2. But what's the issue here? The adaptive system, the T cells and B cells recognize den 1. Full immunity against den 1. What's the problem with den 2? Den 2 is a different subtype altogether. So can the T cells and B cells respond fully to den 2? This is only partial immunity. So because partial immunity, what happens? What happens in partial immunity? You see, den 1, adik dia dah mati. So den 2 datang, kau bunuh adik aku kau tunggulah Sat. Makan aku. Macrophage makan, bawa dekat B cell, T cell, tunjuk. You try to kill me, you cannot kill me. You only got partial immunity. So what I do? So how do I take revenge against the immune system for killing my brother? I invade them. I invade the T cells and also invade the macrophage. Can you see not? You don't kill him, he will take you as hostage. So now, all these den 2 viruses will start invading the T cells and start invading the macrophage. And you know what they do? They start proliferating inside. Diorang membiak kat dalam. They start becoming more. Alright? They start becoming more and more and more and more. So they take our immune system hostage. Just because they got partial immunity, they couldn't destroy them. Now they take over. And they want to take revenge. Because our immune system is already destroyed his brother, den 1. So basically, this dengue infection is all nothing but revenge. Okay? Alright. So what happens? Comes the next stage. T cell and macrophages will rupture. And what happens when they rupture? they release a lot of DEN2. What happens to your body when there is a sudden rise in your DEN2 virus? Your body panics. So what happens when your body panics? Your body starts producing a lot of inflammatory mediators. When there's a lot of inflammatory mediators, meaning what? Your T cell, B cell, macrophage semua banyak keluar. What happens? They start producing a lot of cytokines. Cytokine, your interleukin. And what's are cytokines good for you? In small infection, kalau katakan ada infection, cytokine is good because it causes vasodilatation. Vasodilatation. Why cytokine is important to cause vasodilatation? Cytokines will attract all your macrophage, T cell, B cell. But at the same time, cytokine will also cause vasodilatation so that there is increased blood flow to one area. So more inflammatory mediators can come, more cells can come, and also help in healing process. All your fibroblasts and all that. So a small area with infection, cytokines is good because it causes vasodilatation. That is why the skin becomes red when there's infection, because there's vasodilatation caused by your cytokines. But too much of something is bad. When there's too much cytokines, it causes vasodilatation all over the body. That is why they say dengue can mimic sepsis because of the cytokine storm. And what caused the cytokine storm? Because the sudden increase in DEN2. What caused the sudden increase in DEN2? They were hiding in the macrophage and the T cells. They were laughing at us, and at the proper time they exploded and they started laughing in unison. Ha 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 ha, mampoi lah kau. Okay. So our body's immune response is so overwhelming that it causes vasodilatation. Blood pressure can drop because this is distributive shock. There's only one way how it kills you. This is only one, no. What else this DEN2 does? Because they are running rampage unchecked, they go to the... So I'm talking about the effects in the blood first. So number one, when you talk about complications of secondary dengue infection, first you go to the blood first. Okay? What happens in the blood? So one, because of the increase in your viral load. Okay? Increase in your viral load, it causes overwhelming immune response. Okay? Overwhelming immune response. Increase in cytokines, known as the cytokine storm. Okay, cytokine storm, which will cause profound vasodilatation. So this will cause the patient to go into distributive shock. That is why some patients come BP low. Okay, patients can come with BP low because of this distributive shock. But this is not the end of the story. They got all the other problem as well. Number two, in the blood vessel, what are the cells that line our blood vessels? Okay, this is the endothelium, right? Okay. The endothelium junctions are tight. Why these endothelium junctions are tight? So that circulating blood fluid can't simply go into the third space. Why it cannot go into the third space? Because the junction is tight. Okay, the junction is tight. You know what DEN2 does? I mean, these subsequent DEN infections, you know what they do? They go and they disrupt these endothelial junctions. So now, these tight endothelial junctions start separating. So what happens when they start separating? Yes, you have fluid leaking out into the third space. So now patient will develop hypovolemic shock. Nampak tak betapa jahatnya DEN2 ni, the subsequent DEN. Not only it causes distributive shock, it also causes hypovolemic shock. So the fluid starts going to third space. So sometimes some patients come with, that is why we always say patient have warning sign, compensated, decompensated shock. Warning sign, all the warning sign is what? It's basically fluid loss into the third space. Okay? And with this fluid loss, sometimes patient can bleed. Why they bleed? Because platelet dah lah rendah. Okay? Effect number 3, it also suppress the bone marrow. Once it suppress the bone marrow, white count is become low, platelet also become low. But what happens besides that is that the whatever remaining platelet cannot function because DEN2 inactivates platelet. The circulating platelets are inactivated by DEN2. So patient can start bleeding. So some patient can come with severe dengue with bleeding. Why? Patient platelets are low, and at the same time, the whatever platelets are there are deactivated by who? DEN2. Understand? And patient's hematocrit will start rising. Why? Because patient is very dehydrated because of loss of fluid. So all your cells will come closer to each other, hematocrit will go up. Understand? So effect number 1, cytokine storm. Effect number 2, endothelial junction dysfunction causing fluid loss, hypovolemic shock with increased hematocrit. Function number 3, dia akan inactivate bone marrow and reduce the platelet, reduce the white count. So you have distributive shock and hypovolemic shock. And don't forget, hemorrhagic is because of the loss of blood, right? Okay, so don't forget number 4 is also hemorrhagic shock. Okay, patient can bleed to death because of your inactivated platelets, and this is dangerous, especially for high risk patients, patient on warfarin, patient with coagulopathy. They can bleed to death because the platelets are not functioning. Alright? Okay? And don't forget, when you have hypovolemic shock, what will happen? Your cells don't have enough fluid, oxygen, not enough oxygen. Betul? Because your cells don't have enough circulation, not enough circulation going to the cells. So the cells will start switching to anaerobic. And when this anaerobic, what goes up? Lactate. So when a dengue patient comes with a uprising lactate, what does that tell you? Patient is in shock. Hypovolemic shock or distributive shock. Patient is in shock. And the cells are switching to anaerobic, lactate is rising. So if a dengue patient has a rising lactate, that's a very dangerous sign. You know that you have to restore the fluid. Okay? You have to restore the fluid. Or if in hemorrhagic shock, patient is losing blood, you need to give patient blood. On top of all this, I'm not done yet with blood, no. Sometimes patient may not have obvious bleeding. Patient don't have obvious bleeding, patient is in shock, but the HB is low. Or the HB, not only just the HB, you'll notice that the patient has signs of shock, although patient does not have bleeding. Or sometimes the hemoglobin may drop. Why? Patient is in shock, but hematocrit is not high. When patient comes with dengue, usually in shock, hypovolemic shock, the hematocrit usually will be high. But if the hematocrit is normal or low, then that should worry you. Something may be wrong if patient is clinically in shock. Why? Maksudnya, patient could have occult bleeding. Patient may have not enough circulating hemoglobin. There's such a thing called as hemophagocytic syndrome, HPS. What is hemophagocytic syndrome? The DEN2, tadi macrophage makan DEN2 kan? Tunjuk dekat adaptif tak boleh nak respon, jadi semua ni kan? Betul? Now, DEN2 tu dia gelap balik kat macrophage. Kau cuba nak makan aku kan? Tak jadi kan? Sekarang ni aku buat kau makan orang kau sendiri. So the DEN2 will cause the macrophage to go into super activation. And this super activated macrophage, for some unknown reason, will start eating up our own red blood cells. Okay? 30% of dengue patients have shown to have hemophagocytic syndrome. So, despite you give fluid, the hematocrit is improving, dropping, but they're still in shock. That is a sign that patient is losing hemoglobin. How is he losing hemoglobin? You have to check heart. Maybe he's got some occult bleed. Maybe he's got some bleeding somewhere. But if patient doesn't have obvious bleed, where is the bleeding coming from? It means that the red blood cells is reducing. Why is it reducing? Probably the macrophages are eating them up. So in this case, you need to give packed cells immediately or whole blood. Why? Fresh whole blood? Because you need to make sure that the oxygen carrying capacity is improved, so that enough oxygen goes to the cells. Pumped up. This is just blood, no. I haven't gone to other systems yet. So I repeat, within blood, cytokine storm causes distributive shock. Endothelial dysfunction, leakage of fluid into third space, hypovolemic shock. And then increase in your hematocrit. Bone marrow deactivation causes low platelet, low white count, and these low platelets are inactivated, patient can go into bleeding. 4. Hemorrhagic shock because of profound bleeding due to the inactivated platelet. 5. Patient's hemoglobin can drop even without obvious bleed because of hemophagocytic syndrome, because the macrophages are eating up the RBC. Okay? So now, so this is just blood, no? What are the other effects of dengue besides blood? Start from head. What can it cause in your head? Dengue encephalitis or encephalopathy. Sometimes this virus will deactivate the blood-brain barrier, cross into the blood-brain, and starts causing inflammation of the brain. So sometimes patients can come with fever and seizures or altered mental state. You have to think, fever, ultimate state is not just meningitis, no. If patient is from a dengue prone area, patient could be very well developing dengue encephalopathy. It has been reported, encephalopathy, encephalitis. So, the first effect is on the brain. Next you go to where? Your heart. What can it cause? It can cause myocarditis. In shock, when BP drop, heart rate will go up or not? Yes. Heart rate goes up. But if the heart rate does not go up, if the heart rate is normal or low, does it mean that the patient is normal? Dengue, this DEN2 virus is really bent on killing us. The subsequent infections they really want to kill you. Why? They want to trick us. When the patient's BP is normal or borderline, but because the pulse rate is normal, we think the patient is not in shock, when actually he is in shock, because it has already caused dengue myocarditis. The heart rate drops because of this myocarditis. So you cannot depend on the heart rate. You need to examine for yourself. Clinically, is patient in shock or not? Never ever depend on the vital sign. The vital sign especially will trick you in dengue. You have to examine clinically. Alright? Don't worry, we will go through the management principles, how to manage. But remember, the effect on the heart. If heart rate is normal or low, you have to be worried. In dengue, patient come in shock, usually it has to be tachycardia. But if brady or low, you know this could be dengue myocarditis. Next effect is where? Liver. What causes in the liver? It can cause transaminitis. It can cause hepatitis. It affects the hepatocytes. It causes necrosis of the hepatocytes. So usually patient can come with tender liver, enlarged liver, and the ALT and the AST will rise. Usually the AST more than the ALT. Okay? So it can cause problems with the liver as well. How about kidney? It can cause acute kidney injury because of your hypovolemic shock. Because of hypovolemic shock, it can cause acute kidney injury. So can you see not? Brain, heart, liver, kidney. And when all these come together, also lungs, don't forget. Lungs also, what it can cause? It can cause fluid leakage, and in certain patients it can also cause ARDS. Okay? It can also cause inflammation of the lungs as well. But very commonly in the lungs, it can cause pleural effusion as well. Patient can come complaining of shortness of breath because of pleural effusion. So that is why when patients come, you have to examine this very few important systems. Okay? Your neurological, your respiratory, your heart, your liver, and your kidneys. Understood? Okay? Even kidneys also, urine output will be affected because of acute kidney injury. So do you understand how DEN2 works? But eventually, will DEN2 win? Yes. DEN2 will win if you allow it to win. Do you want to defeat DEN2 or not? Yes or no? Yes, you want to defeat DEN2. Ni macam, tak apalah bagi DEN2 win lah, so okay lah. You want to defeat DEN2 or not? Yes, you want to defeat DEN2. So you must understand exactly how DEN2 works. Now you know what exactly DEN2 does to you. But eventually, if we support the patient well, give enough fluid, okay, we give some blood, stop the bleeding, eventually the body will become smart. It will adapt. T cells and B cells eventually will recognize this is DEN2, start producing T cells and B cells. Eventually the body will defeat it. But during this critical period where the patient is very vulnerable, if you do not do anything, DEN2 will win, patient will die. And DEN2 would have got revenge for DEN1. Okay? Virus 1, human 0. Okay? So now, in order to defeat it, you need to understand at this stage what happens, support the patient at this time, so that when he goes to recovery stage, this is where the body's immune system has taken over, and this time around, the body is able to fight back. Understood? Okay.